The TREND-IVT trial is a multi-center randomized clinical trial performed in China to investigate the intravenous to investigate the safety and efficacy of early antiplatelet therapy with aspirin following intravenous thrombolysis within 3 hours in patients with acute ischemic stroke. And we all know that also the intravenous thrombolysis is effective in improving the functional outcome of patients with acute ischemic stroke. And there is also a very common clinical questions is that we may encounter patients with neurological deterioration after intravenous thrombolysis. And the current guidelines recommend that the antiplatelet therapy can only be used 24 hours after the thrombolysis therapy. And a lot of patients may experience the neurological deterioration within 24 hours following thrombolysis. So a lot of therapies has been investigated to prevent or to the treatment of neurological deterioration after thrombolysis in patients with acute ischemic stroke. And the most promising therapy is about how to use antiplatelet therapy in these part of patients. And we all know that it's about in the 2012 the ARTIST trial published in the Lancet and showed that it may be harmful to use aspirin following intravenous thrombolysis in patients with acute ischemic stroke, as it can increase the risk of symptomatic intracranial hemorrhage. And now in recent years, a lot of studies investigate the safety and efficacy of intravenous tarifaban for the prevention and for the treatment of acute ischemic stroke patients who received intravenous thrombolysis. But from our research group, we found that the patients who received aspirin, if the aspirin was used in a high dose, and the effect and its antiplatelet therapy can be effectively within 15 to 30 minutes, and it can play a very important role in the prevention of neurological deterioration after thrombolysis. And the main question is how we select the patients with high risk of neurological deterioration and with small risk of intracerebral hemorrhage. And from our previous studies that performed based on observational study, and we found that patients who didn't receive the antiplatelet therapy before the intravenous thrombolysis, and patients who have culprit vessel stenosis maybe have a high risk of deterioration with a small risk of intracerebral hemorrhage. So against these backgrounds, we launched a multi-center in China. It is the TREND-IVT. And the TREND-IVT was to use the 300 aspirin after intravenous thrombolysis within 3 hours. And and we will evaluate whether it could improve the functional outcome, the functional outcome defined as functional excellent functional outcome defined as a modified ranking score of 0 to 1 at 90 days. And now this study has also been begun in China, and we will include we will recruit about 1,180 patients. And we also hope that in the following 1 or 3 years, we will complete our recruitment, and we hope that this trial can provide the evidence about the early antiplatelet therapy following intravenous thrombolysis in patients with acute ischemic stroke. And so finally, we also hope that the guidelines may change based on this evidence.